Then I really would like to thank you for accepting the invitation, and it's a pleasure to have you here in this weekly conference of Coincides. As I explained you last time that we had the opportunity to talk, this is a group of leaders in the state of Jalisco, but also in the west part of Mexico, that are very interested to do something different and to make changes possible. Then to hear you and to hear different colleagues from the sector and also from other industries will be really an opportunity to make this a really think tank, a true think tank. Then thank you very much again for accepting this invitation. This afternoon we have also with us the Secretary of Health of the state of Jalisco, Fernando Petersen. And once you finish your presentation, we will open the dialogue in order to hear the whole group that we have this afternoon together. Then thank you very much again, Dan, and I will give the microphone to my friend Jaime Reyes. Jaime, again, thank you very much for your complete and unstoppable support on this issue and these topics. And it's also a pleasure to have in our team, to have you in our team, Jaime. Thank you very much for your help. Jaime, the floor is yours.
Thank you. A little bit of background. In the first quarter of this year, I took a short online course with MIT Sloan membership. And the subject of the course was artificial intelligence applied to healthcare. And it was a great course for a 6 week. I was commenting to Cesar that every week, it's like having a quiz every week, and also the opportunity to interact with more or less 380 people from the 5 continents with in a very intense course that give us the opportunity to interact in a general forum with our comments and learnings. So at the end of the course, Dan, who is one of the professors of MIT as well in Oxford and Harvard, invited us to have a think tank, which we have been meeting monthly. Every month, we meet probably a group of 28 to 32 people, also from different countries, with topics that we continue learning on how to apply technology in healthcare. So during these opportunities, I talked to Dan about the possibility of having this conference with very specialized people in this event, so we can hopefully establish a bridge between MIT and the healthcare ecosystem that we have in the region. So with that, Dan, Cesar, we can have Dan to go over the presentation.
My name is Dan Kishore. I live in Colorado, USA. And the topic of discussion for this session is the future of healthcare. I'm sorry and apologize that I don't speak as much Spanish. I can carry along with some numbers, buenos dias, buenas tardes, and noches. So apologies for that. I should learn Spanish. Agenda. Now this is kind of very a demanding agenda for an hour of discussion, but nonetheless, we will try to make this as better as possible. So first of all, we want to talk about past, present, future, retrospect of healthcare, diseases, and causes. Now, without knowing what has happened in the past, we cannot know the present and future. And also, there is a link between how and what happened in the past to predict what will happen in the future. Second is telehealth promise, which is a global healthcare infrastructure with technology, obviously. The healthcare is expanding in such a pace that we can no more guarantee a physician's physical presence to take care of our health problems. So we'll have to get to a solution where we are going through taking help of technology to get to the core of the healthcare. AI and technology. Let me see if, okay. I should do the pointer on the other screen. Okay. So healthcare, AI, and technology. Basically, we can classify the technology into two parts. One is artificial intelligence, which is combining the machine learning attributes of the technology, and we will be actually making it more of a decision-making mechanism. And there is another stream of technology, which is pure technology, like mobile device, the mobile devices, monitoring devices, etc., which is pure technology, and it's being enabled by other technological infrastructure that we have been experiencing in other walks of life apart from the healthcare. Then we have healthcare everywhere. It's very important that we have transited from patient going to the hospital to the healthcare services going to the patient. We'll talk a little bit on that. And we have healthcare and climate change. I do not have many slides, but we know what is happening with the climate change. The ultimate result of any climatic catastrophe will result in death, trauma, and a lot of burden of disease. So in that sense, it's very much important that can we control climate change? We can, but it is a greater obligation. But definitely, it will result in healthcare crisis and has been resulting in healthcare disasters, which we'll have to definitely confront and tackle. Lastly, the ethics, data privacy. As we all know, as we introduce more and more technology, as we integrate more and more countries into the realm of being treated and being helped by the technology, we will definitely run into the problem of what is ethical, what is not. And that's important to know that we have to be within our realm. So that's a broad agenda. And this is my kind of short synopsis of what I am, who I am, and what I have done. I will share these presentation slides with Jaime, and he can share to the greater group. So, a retrospect. If you look at this map, you have smallpox, measles, and bubonic plague, and whatnot. And if you look at the arrows going from one continent and country to another, it is all on the trade routes, because the only people who were traveling in the past were traders, merchants. So essentially, I would put it as people who are traveling were more susceptible to the diseases, and they are spreading the diseases in a similar fashion along with them. So trade happens, and the spread of diseases is also happening. In a similar context, we have a spread of syphilis across the world in different time frames quoted in the 1493, 95, 1498 in India, and 1505 in Japan. So obviously these dates are kind of straddled because the transport mechanism was not as much efficient. But nonetheless, what I would like to emphasize in here is, if you look at from a high level, this is similar to what the COVID has done. It has traveled from one part of the world to another part of the world by not traders, but along with the traders, people who travel a lot between the countries on business, on pleasure, because this is a globalized economy. So a globalized economy has exposed everybody to every kind of disease. It doesn't matter where it has originated, it will be there everywhere in no time, if unless it is mitigated, controlled. And that is where we have to put all our efforts and infrastructure to use to control such a kind of transmission. And COVID is an excellent example on that. Very high level, what we have basic mechanism. This everybody understands this. We have signs and symptoms, and we have diagnosis, and we have interventions, and we have testing, evaluation, and cure, which is interacting with these different classes of processes. What is essential to learn is we have been introducing improvement, enhancements, developments in detecting signs and symptoms. Diagnosis is being driven by technology, where the testing and evaluation has become more technological oriented. It is online, and it is very much diversified. Intervention and cure are also being done in a good pace. The only difference in what I'm saying and what is happening is that the pace of disease, the transmission has been a lot more speedy than the interventions. So that's where we have to put our efforts into. So telehealth, the global health equity. So what has opened the doors for us to get greater health is, for example, I have a global presence, global network of professionals, healthcare practitioners in practicing healthcare across the world. So for example, I can call in somebody in Europe for arthritis, in New Zealand for mental health, sickness, psychiatry. I have a neurosurgeon practicing neurosurgeon in Australia. Now, what does this mean? It means that if somebody is not available within the United States due to the lack of physician, or I mean in any part of the country, due to the lack of physician or resource crunch, you can still tap into global organization, a global network, to get immediate results. So this is where we can cut short the time of analysis, a diagnosis, and all this from weeks and months to probably days, because global knowledge is more stronger than any one local knowledge. I'm telling this in the context of the United States, but it is true for any country. And I have personally experienced this, where we have patients coming in, and I have an ability to immediately do a message to across the world and get at least about 5 to 10 different responses from across the world, what to be done immediately. And sometimes they also send in supplies and some technological help as well, or on-call support from physicians. So that is where, even if you go to a rural American town, we can still tap into the global network. That is one of the initiatives of the telehealth. And also, once we tap into such a network, we will definitely have a handle on what is the patient presentation, how is the patient presenting the symptoms, and what can be done in a, there is some teams called as MDTs, multidisciplinary teams, where which analyze the situation and decide what to be done. So this is possible only because of communication technology. Right now we are doing a conference here because of the communication technology. Similarly, we can use the same technology for tapping into the global talent in a telehealth situation. And this is very important and easier to implement. Actually, we are doing this already, but it could be helping far more people, like let's say in Africa or far-flung places where there are meager resources of healthcare professionals. Now, then comes the distributed healthcare. Now, this is if you go back to a technological perspective, back in 1980s, we have PCs and the computing machines connecting to different networks and thus forming an internet. Now, what has happened is the computing power, which is housed in a particular location, right now is distributed on the internet. So basically, we are telling that we have computing power wherever we are in the world. It doesn't matter whether the machine sits in US or Philippines or Mexico, it doesn't matter. So irrespective of the computational power, we have taken the benefits of such computation to every corner of the world. This is exactly similar, but in healthcare, where we are talking about distributed healthcare, where taking healthcare to where people live. Now, if I have a patient living 100 miles away from a hospital, I cannot really tell them to come to the hospital. I can tell, but it may not be feasible or practical for them to come to the hospital in that situation. So hence, we have to take them to the place where patient is present, which is where, if you look at, again, this is from the US perspective, we have Walmarts and Costco's and Walgreens everywhere across the US. So why not tap into their retail network and then make it the healthcare to the people where they live? So this is a map which says, CVS says, I'm not promoting any company here, but generally as an example, we meet people where they are. That's the CVS, and we have so many CVS stores across the US, and each of them have their own clinic, and that becomes a primary care option for the people to go and get primary care. Yeah, on the right-hand side, we have Walmarts, and Walmart has Walmart Pharmacy, and right now they have they serve about 150 million people or so, households in the US, and one can get a dental exam for maybe $20, $30 without any interference from the insurance or payer network. That is a relief for the patient, because the more we make services available for the patient, the more the patient uses the services, and hence we can achieve the healthcare delivery and healthcare equity in that context. Now, how is that possible? Again, with the technology. We have to enable technology to go to these far-flung places to help the patient. Now, an excellent example for that is, this is a graph showing the COVID vaccine being distributed across the United States. It has been drawn from the beginning of this year till August 14th. Now, what I would like to emphasize is the backdrop of this graph is, to me at least right now, for this context, making the healthcare available to people across more outlets will introduce more healthcare equity into the system, and thereby it will go and increase the healthcare of the people itself. So in here, on February 12th or something, on this line here, Federal Retail Pharmacy Program for COVID vaccines was introduced, and it was released to 40,000 stores across US. So what is the effect of such a release? What it did was, it has, if you look at the graph, it has taken the distribution of vaccines right from under 50 million to around 125 million-ish in about a month and a half. That is where it has the technology which was introduced to sell these vaccines or make the vaccines available to the retail stores has contributed to the overall delivery of the healthcare. So that way, we can literally increase the healthcare benefits to people. So when you look at the graph again, proceeding on March, between March and April, we had Costco, which started the COVID vaccine, and around May 4th, this time, mid-May, Walmart also started with the COVID vaccine. So all of this has helped the overall society to get the vaccines from under 50 million to above 150 million. It is a huge leap in the increase of vaccinations to the people. And this is what is called distributed healthcare. It's an excellent example of taking healthcare to the place where people are there, patients are there. Now, changing the gears to technology again, we have, I'll give an example. In late 90s, we had a certain computing power. In 2020s, mid 2020 and late 2020s, we had totally different computing power. In late 90s, even a supercomputer was slower than the computers that we have right now. So having said that, we have lots of data, we have terabytes of processing power, petaflops of processing power, don't have to be bogged down with these numbers. What they really tell is that we have a lot of computing power, so we can actually analyze the data which is generated across different data sources across the world. So that is the glory of technology helping the healthcare and any other industry. Whenever we talk about creating, identifying, and talking about gene therapy, we are talking about tons of data, extreme data. That is where this petaflops and this power of computing comes in handy, where we can crunch in that data in no time. As well as, while in 1990s, the computing power was introduced, was taken help to create HIV vaccines. All they could test was about 100 different molecular structures for the HIV vaccines, which was not as much promising. Why? Because that is a lower amount of molecular structures which may not exactly fit into the bill of being a vaccine for HIV. But fast forward to 2020, we can do billions of such molecular structures that can help in quickly and efficiently create life-saving drugs made possible with technology. Of course, technological processing power plus the artificial intelligence and machine learning techniques which help in learning what we want to be done by the machine to how we want it to be done. And finally estimate the results, look at the results and approve or disapprove. And hence the machine learning goes on learning from its mistakes, and it will reach a particular point where it will definitely give a solution. So going forward, there is another technological intervention that we have discussed, technology for healthcare, which is rheumatic heart disease. Now, this affects so many people globally, and a lot of people die out of this disease, but they don't have to, because we have ultrasound screening developed by the community, healthcare community, which can easily detect the RHD, and hence that will help us in eliminating or saving the person from death. So this can be deployed in remote villages and thus preventing the deaths of such patients. So this is how the technology, this is a low-grade technology, high-grade technology, but still helping the community. Now coming to the intelligent systems, AI in healthcare, all I want you to know about this is, it is a neural network of an intelligent AI healthcare system, wherein each of these nodes will process a certain kind of information and pass it on to the next. So we don't have to be bogged down with what happens in between, but what we are necessarily looking at is how can we read an image using this network. Now, as a very simple example, I want to quote, similar thing is happening with ants. They get stimuli from the environment here, and each of them will process the stimuli in a very basic format, like we do with our neurons in the brain. Neurons in the brain, they just fire or not fire. They don't have much intelligence as such as attached to it. What makes them intelligent is the group of neurons doing the same thing concertedly, and that is what makes it more beneficial to make a decision. So also we can introduce complex neural networks to read images of mammograms and detect breast cancers well before it becomes a major tumor, major cancer, and progresses in its stage, so that we can avoid deaths. And another system that I was talking about is the hospital bed management. Now in here too, we have historic data, which will help us in creating the electronic health records database here onto the left, and daily extraction and feature processing, which will help the machine learning database to crunch in the incoming data and do predictions of when a bed could be made available. Now, this might seem a little complicated, but think in terms of airline tickets. You have so many flights, you have so many destinations, and the fares are up and down every day, every moment. How are they trying to do? They are just trying to make their seats as valuable as possible. So in here, if you compare that loose connection, I would say the bed is our airline seat, and we already have the technology to distribute airline seats very effectively, very profitably. Now, the profit in this bed context is that availability of bed and saving the people, saving the patients, and maximizing the efficiency of a system. Those are our key performance indicators. So we have the technology, we have to tweak it in such a way that we are successful in judiciously allocating bed management, allocating beds to all patients, and more importantly, critical care patients, as well as administration of these things by the administrative staff. So going ahead with the same thing, we have ability, if we introduce the artificial intelligence into the system, we have an ability to have options, different options, 1, 2, 3, and 10, whatever. Each option will give us a number of beds that can be made available in an optimized fashion. So a graph of that will have the lighter color graph is when the system was not introduced. The solid color, the flattened graph, is when the system, AI system was introduced to allocate the beds efficiently. And hence, if you see, we have saved 21 beds by introducing automation and artificial intelligence into the processing of allocation of the beds. Now, I might make this kind of simple, but it really works because machines are configured to do one thing and only one thing, or two things. They do not really go and solve world problems. They help us with processing complex data, which we can process given some time, but we want this complex data to be processed in shorter time intervals. That's where the problem is with introducing human beings. So we resort to artificial intelligence and technologies to make our lives easier. And going forward, we have another third one with intelligent systems in AI healthcare for breast cancer early intervention. If you look at these breast mammogram images, to the left is the initial phase of a tumor. Now, by any physician or oncologist looking at this particular mammogram may or may not detect this one. But as the years progress, I think this is on a consequent years, what happened was it has gone to be becoming a tumor in the amount of some time. So in the third image, you see the enlargement of the tumor. So we can feed and train artificial intelligence systems to know what patterns of these ducts, basically best have the milk ducts, and the main form of cancer is the ductal carcinoma in situ. So those things, that the patterns that a machine can recognize easily and effectively and with speed, we cannot do that. For example, if a physician or oncologist has to look at such images of 1,000 images, the whole day is gone, a whole week is gone in that. But if you feed the same thing to a machine, you'll get the results in a couple of hours. That is the beauty of introducing the technology, artificial intelligence, properly trained artificial intelligence in solving the health problems. In here, we have definitely introduced the intervention a lot before even when it became malignant tumor. That is what is most important to us, the speed and accuracy and efficiency, which is guided by human doctors. the missions are guided by the human doctors, obviously. So jumping on to the next is, you might have heard about Internet of Things. And also 5G communications. Now 5G, as an introduction, it is a speedier and more ubiquitous communication infrastructure. You might have known about 1G, 2G, 3G, 4G, and now comes the 5G. It's loosely told, I can probably equate that to 10 to the mega, giga, and tera. So in 5G, we're talking about tera, which is 10 to the power of 12 range of communication. So essentially, what we want to get by this slide is that because of this, the 5G infrastructure, communication infrastructure, we are right now able to actually get data from any of these sources of data, which we are interacting in our day-to-day life in terms of healthcare. Maybe it's a mobile device, maybe it's an ambulance going, maybe it's monitors which are attached to the patients, which are relaying the signals. Maybe it's the video of a person who is undergoing a pain and which can be treated remotely using the telemedicine. So this is how the technological revolution is changing the face of healthcare industry. Now in here we have a mobile monitoring examples, especially the middle one, which is by the MIT's Emerald device. What it basically does is, the Emerald device is an inconspicuous device put in a room, which can monitor whether the patient is at the bed or in the bathroom or in the kitchen. So each of these movements is monitored and labeled with a color code. So whenever the patient is at the bed, it says, let's say, blue color. Whenever the patient is at the kitchen, maybe it is a different color. Whenever the patient is watching TV, it could be a different color. So looking at these colors of patient movements, we can say, what is the maximum time? Is the patient sleeping properly or not? Is the patient eating more? Is the patient just whiling off time watching TV, or just walking around the apartment or dwelling? So there's a lot of information that this particular graphic can convey. And added to that, we can as well include the monitoring devices, mobile devices and others. Also, this is the device which I'm talking about, the Emerald device, which monitors the sleep patterns. Now, a regular individual may not really observe that while they are sleeping, there are bits of times here where the heart doesn't beat. So that's called sleep apnea. So when we monitor the patient or the person with these devices, we will immediately know, even in the initial stages of the sleep apnea, we can detect that this person has this disease or the breathing problem with the breathing signal, and immediately have a correction mechanism implemented as an intervention. Without these technological advancements, we cannot really do that. On the right-hand side, we have several different EKGs and graphs of the electrocardiograms, where we have so many heart rate monitoring, blood pressure monitoring devices these days. So any discrepancy in such a kind of pattern will immediately alert the patient, as well as we can configure this alert to go to the patient's doctor. So immediately they have intervention started, or a call will come to immediately submit to the hospital, and will do the necessary preventive medication or preventive processes. And this slide shows what are all the different monitoring things that we can have. And jumping on to another facet of artificial intelligence, which is very helpful, is technology for life-saving drugs. You know, the drug development takes a lot of time, a lot of years, it's a painful work, essentially. Why? Because they first have to identify the target that they want to mitigate in a pathogen, and then create a formula that would effectively interface with the target and destroy it. So my next slide will show exactly that. So choose the target protein. Here I have taken a COVID virus protein, a spike protein, and which would tie in with the human receptor here. So our target protein is spike protein in the COVID virus. And we know the molecular structure by studying that protein. And we dip into our thousands of already known compounds, medical compounds, to see if that fits to this particular molecular structure to destroy the virus, which is some people might have allude to the hydrochloroquine as one of the solutions, which is not, obviously. I'm not proposing that, but there could be a chemical compound which is already created that could be of help in a situation to control a disease. Now, if you find that there is no such compound, then we can go to 1 billion or more compounds, new compounds that we can create and test with seeing if this molecular structure can be controlled by these compounds, and hence get a rank of the compounds which are best suited for this job of destruction of this protein molecule. Now, only the AI and technology can do this, because we cannot go and sit and test 1 billion compounds. That's just unpractical. But introduce the AI and introduce the system technology to go through the different structures of the compounds, match them with the molecular configurations, and boom, we go ranking of the compounds which are best suited and which are worst suited. And then we take the ranking of the compounds, take the best compounds, and try it, come back to our normal process of drug creation and verification and testing, do the experimental testing, and go to the RCTs, and hence create a drug in no time. I'll show you an example of how fast that could be. If you look at the COVID vaccine development time frame, it is excellent and marvelous example, wherein if you look at the timeline, January 13, 2020 is when the mRNA sequence was created. When did the COVID virus come into public news? Maybe late November or December 2019. So given that time frame, we're talking about 1.5 to 2 months. Excellent. The same thing without the artificial intelligence, without the technology, would take decades. If not decades, sometimes several years at least. So that is the power of technology, where we can create something. Now, what has taken time actually to get the vaccine approved? Basically the testing. If you look at from March 16th to November 15th, it is all different testing that we have done. That is what took time. So this was never anticipated in the history of vaccines. As well as mRNA vaccine is a technological advancement. It is a different type of technology for vaccines than we had before. So these are the things which can make our drug development easier, faster, and efficient. So I want to take a case study on the COVID intervention itself. Now, if you look at the COVID, the transmissibility, and compare it to different diseases, we have COVID-19, 3 people is the transmissibility. This is called R0 factor, where how many people will be infected by an infected person. COVID-19 Delta strain is 7 people, and chickenpox is 10 people. But if you see measles, it's 18 people, mumps is 12 people, HIV is 4 people. So what I want to drive home with this slide is that the rates of infection is different for different kind of viruses. So our successful attempt to control any pathogen and any pandemic is, how can we limit this transmission? That's a main thing. Yes, we can have vaccination, that's the second route, but in parallel, how can we avoid and cut this transmission? So transmission happens in several different ways, home, train, work, etc., etc. So one person will give to 10 people, will give to 100 people, will give to thousands of people, right? That is a transmission. So our mantra to effectively eradicate this virus is beat the virus. Where if it is infecting 100,000 people in 2 days, we have to inform 1 million people in an hour to take precautions that you might be infected with COVID, please take precautions, quarantine. Simple, as simple as it is. That is what is enabled by the technology. So I have a kind of comparison map here where this is a tornado alert system. Every country has this, and we know pretty well that when there is a tornado in our neighborhood, we get automatic alerts to the cell phones. That is established technology. Now, for a moment, consider the tornado to be a COVID virus victim. Simple. Translate. A tornado to be a COVID virus victim, infected person, and then transmit to all the cell phones who have been in that GPS location immediately as a broadcast. You don't have to worry about confidentiality, because this is same as tornado broadcast. We are just broadcasting that you may be at risk of possible COVID infection. We're not telling you're infected, possible. So that that person or the group of people will take care, will get tested and quarantined. In that way, we are ahead of COVID transmission. That is what we want. We want to jump away, jump over the pathogen to control it. We go behind the pathogen, we cannot control, because it re-manifests again and again. So that is how we can use technology, our existing technology which can be repurposed, or the new technology which can be developed. But definitely in a globalized, connected world, we have to have technology to combat pathogens and diseases. So that is the end of my presentation right now here. I am open for questions. I hope it was not too fast.
It was very interesting, Dan. Thank you very much. It's really amazing what you have been doing the last few months, using technology and to try to make an outlook forward on what could be happening in the next years with these kind of transmissions and the new future of the healthcare industry. I would like to ask the Secretary of Health of the state of Jalisco, Fernando Petersen, his first reactions to these interesting presentations of Dan Kishore.
And thank you, Dan, for this wonderful presentation. As you've presented, there's a lot of investigation and a lot of time invested in cutting and in getting to know how to cut transmission from one patient to another, which is the holy grail of the whole point. If you cut transmission, you cut the possibility of getting infected and of transmitting the disease from one to another. There are many people working on this kinds of issues, and in your last presentation, it was a point of importance for me to see that the map was done between Google and INEGI. INEGI is the part of the government of Mexico which takes care of all the numbers of people and of all the things that are doing. And that is very important for the government to take into account. It was very important for me to see that, because we've been working with Google for many months, trying to see and trying to get across this kind of artificial intelligence. The point is, which has been one of the topics that you didn't get to, I think because of the time, but the problem is how to advance in that sense, taking into account personal data and how to make sure that all this data, which are common, which are public, because your number is public, all this data do not become part of public information. That is something that has been driving us a little bit crazy for some times. We've been working with Google, parts of the government of Jalisco have been working with Google, trying to get these technologies into Mexico, just to make sure that everybody takes into account that this important advances in technology are available and can be done and can be used in the real day-to-day life. So it was fascinating for me to know that there is a communication between INEGI and Google, which is part of our sharing and of our duties right now in getting to know how do we get that. Thank you very much for this very interesting topics and conference. And I look forward to getting more into touch with you and see how we can advance in Jalisco with your team in the advancement of this, I think, unique, I hope unique. You can see some very young people in Coincides. No, I'm one of the oldest, and I don't want another pandemic to be seen in my life. So thank you very much for all your information, Dan. Gracias, Cesar.
I just have one comment on that problem that you have indicated about the data privacy and policy. Actually, if we try to differentiate data when an event happens, it is extremely difficult to separate private data and public data. But if we start with architecture, data architecture, which has already sorted that private and public in the beginning in the form of a standardized electronic health record, then you know what is private and what is public for that particular patient, and you can immediately release the public data without any kind of hesitation. So in that way, a proper data architecture in the beginning will help in the long run.
Thank you very much, Dan. Thank you.
Sure.
Thank you, Fernando. Thank you very much. We really appreciate your participation, Fernando. Well, Eduardo González Pierre, former Undersecretary of Health in the federal government. You are a very experienced professional in the health industry. You have a lot of knowledge about these topics that this afternoon have been talked about. Then, what are your first reaction on these items that Dan, the speaker that we had this time in Coincides, talked to us? We are very interested to hear you, Eduardo.
Cesar, thank you very much. And Dan, thanks again for the wonderful presentation. I think we're very interesting times. Definitely there's some very disruptive technologies coming up. I think change is probably going to be faster than what we can manage and in many cases adopt properly. All changes, especially these technologies, come with a risk. And I think there's going to be a big challenge on how to safely and properly manage change and manage the implications. For example, it will have on the workforce, on the way people will behave and respond to these things. My experience and in particular impression is that many of these things are ahead of its time. Health is a very conservative system, in particular the way physicians behave. I would like to get your views, especially on your last slides on artificial intelligence. I think artificial intelligence has been hyped much more than what it has promised. I think artificial intelligence is good in image recognition. I think in terms of diagnostics, it's far behind. I would like to get your views on what happened to Watson and the much mentioned disruptive change that IBM was going to do with artificial intelligence. And I think there's very important lessons on how to take things with, let's say, a bit of care in terms of how to introduce things and make sure that there's no unintended consequences or maybe some sort of damage that can create some backlash.
Yes, definitely. That's a very good question because I'll give a similar example. If you look at the technology, right, in the telecom industry, it has started with like landlines and cell phones and flip phones. There used to be a time when caller ID used to be costing money, call forwarding costing money. But we have gone over those, and right now it's all inclusive. We just charge data. And then, this type of conferences, they charge a lot of data. And when we say that we want to charge for data, then we are limiting ourselves not to do the conference, or pay under the fees, the unknown fees or hidden fees, to get to the conference and keep things going. So that is where the problem with technology is. Now, somebody can come in and say artificial intelligence is a holy grail, but I would say, let's talk about a muscular person who is able to lift a heavy weight. But unless he is trained to do that, he is useless, right? So artificial intelligence is also, it's a extremely powerful tool, but it is what it is, how we train it. For example, if you train the same AI module with not so good data, we will not be happy because it will do wrong predictions, and we cannot really blame on it because our data is wrong. So the most important point of any AI implementation is how good is our training data, and how we can mold this piece of clay into a beautiful statue, how we can carve a virgin stone, marble, into a sculpture. So what AI is a marble stone. What we do to it in the form of learning mechanisms, data sets, refinements, are all the things that are going on to this marble stone to get a beautiful sculpture. Unless we have right things in place, we will not get to that result. So I agree with you that there's a hype, and I agree that's coming from technology part of it, because the technology is more of hype. Like, for example, iPhones or Samsung smartphones, they come with hype. I mean, obviously there is a lot of things that are packed in one thing. I'll tell you just one example where in financial industry we say we have to diversify and put all our eggs in different baskets because of spreading the risk. But in technology, we put everything in one basket, one iPhone, one smartphone, which can be a major cause of failure. So we have to be very much cognizant of what and how we handle this technology, rather than say, oh, this is a technology, use it and we are done, we are rescued. No, that's not the concept. It depends on how we use this particular machine to our advantage, and the testing is utmost important as well for us to get right results, correct results, not the hype ones.
Thanks a lot. And I think now it's time to come back to Jaime Reyes in order to hear from him. What is our vision about the future, and how Eduardo Gonzalez and obviously the Secretary of Health, Fernando Petersen, and with the private sector group that is been involved in this project, how we are seeing the future in the health industry in the state of Jalisco. The state of Jalisco is very important in the pharmaceutical industry sector. We are very important as well in hospitals and laboratories located in this west part of the country. But we want to be the best region in healthcare. Then, Jaime, how do you see this opportunity, and how do you see the way that we need to link the artificial intelligence and all this technology applied with our projects? Jaime, please.
Yes, just one quick comment. What Dan was explaining to us is that computing power and data mining, internet, 5G is exploding. So it has happened in the last couple of years. Way into the future, and not too far into the future, is quantum computing, and 5G and 6G or 7G. So technology tools are exploding. So the other thing done is natural process language. which you know is a great tool to extract information from libraries to help us on with artificial intelligence or machine learning as well. I think that this is a great opportunity for us, as el Dr. Fernando Petersen was saying, to establish a bridge between the ecosystem that we have in Jalisco with MIT, with the professors of MIT. I see one big opportunity because a lot of this technology has not been properly explored. One example is the Emerald Project. The Emerald Project, when we talk about it, on monitoring the 24/7 and preventing, diseases or defining diseases early stage, that we can prevent cancer and Parkinson and Alzheimer, is a great tool for us. So what I recommend, Dr. Petersen, is to continue the dialogue with Dan so we can establish specific projects, because we talk about in general. If we define specific projects that we can work together, and the advantage is that in the US is highly regulated. So a lot of these technology advancements is not because technology is not there, but it is the application of the technology in different parts of the spectrum. So why don't we, and here in Mexico, we are probably less strict in legal terms on how to apply this technology and get the benefits of it. So why don't we establish specific projects between the ecosystem, the health system, the ecosystem that Cesar was mentioning in Jalisco, and establish a partnership with MIT professors and pick up one or two projects that we can work together and apply it here in Jalisco and advance the prototyping of this technology before we explore it in a bigger scale. So that is what I have as a vision, Cesar.
Excellent. Excellent, Jaime. Excellent. I think that's exactly the key point. That's exactly what we need. Dr. Petersen, do you have a reaction about this proposal of Jaime?
Actually, it was the proposal to continue working and walk that way. We are now studying and working especially on artificial intelligence on diabetic retinopathy. And we are doing just pictures of the retina and in first level centers, and then transmitting that pictures to an ophthalmologist, just to make sure that we can get the people who have diabetes on the first stages of diabetic retinopathy. So that is something we are doing right now. We're working on that, and I'll be very, very glad to work on one or two different ways of getting artificial intelligence and other things in progress for the health system in Jalisco. I think that that is a very good idea.
Excellent, Dr. Petersen. Dan, do you have just brief comments? We have another three colleagues that would like to make comments, and we are almost at the last part of the conference. Please, Dan.
Yeah, it's definitely a good thing to have partnerships, and obviously, as Jaime has indicated, the regulation part of it on the Mexican side helps than on the US side, and as Peterson and other people have indicated, we could have a couple of products partnered in the Jalisco region, and have them like a progression, where upon the success, we can build upon the success by such partnerships. Definitely. Yeah.
Excellent, excellent. Thank you very much. Well, I think it's time to conclude this meeting, and I would like to ask Jaime Reyes to make a summary of the conference that we have had, and especially the next steps. What do we need to do within the next following months in order to achieve our goals, especially in the master plan that we are creating in the healthcare industry in the state of Jalisco? Please, Jaime.
Yes, first, Dan, thank you very much for your excellent presentation. I think that you cover a lot of territory, a lot of projects that you're working on. And so this is, I believe, the right time for Jalisco, for the health industry ecosystem to get the benefits of the technology that is just exploring. So I think what I propose, Dan, and the rest of the audience, is again to have one or two projects that we can work together. Dr. Peterson mentioned one that is already in progress, that we can benefit with the this potential partnership with MIT, because we can have access to many professors and researchers in other universities as well. So technology is in healthcare. I think that I have commented to Cesar that several sectors are exploring, like cinematography, like agro-industry, healthcare, and also prevention of delinquency. So what I propose, Dan, if you agree, is to work with Dr. Peterson on projects that are already in progress, to speed them up and work this partnership. Once we have done that, then we can cover other technologies and cover more ground into the future. Again, you know, just taking this course for 6 weeks, I was amazed on the potential of this. The project that I like very much is the Emerald project, where we can monitor patients at home and prevent or detect illness very early in the stage. So Cesar, that is what I can conclude, and I think that you assemble a very good audience of experts, and I have high hope that this conference will be the first step for a potential partnership.
Excellent. Thank you very much, Jaime. Thank you very much. As usual, you have been very, very supportive to this group and in its goals. Dan, your last comments and your conclusions, please.
Well, I'm pleased to attend this conference and give the session. Thanks for the opportunity. It is, as the world is changing, the knowledge is all over the world. So collaboration is the mantra to go with it, partnership, collaboration, and the thoughts, the ingenious thoughts and intellectual capacity has to be put to use for the benefit of humankind. And I'm greatly appreciating the efforts that Jalisco is taking in implementing the cutting-edge technologies and caring about the healthcare part of it, and establishing healthcare equity, the value of the healthcare, which will be increasing into the future for the benefit of the people of the state. And thanks, and wish everybody good luck. And I'm here to help, partner, and do whatever I can to keep the ball rolling and keep the progress on traction. And thanks, Jaime, for the opportunity. Jaime and Cesar.
Thank you very much, Dan. We really appreciate your excellent presentation. And I also would like to thank Dr. Fernando Petersen for his participation, Juan Carlos Flores as well, as Secretary of Education, Eduardo González Pierre, Undersecretary of Health in the federal government in past terms. And also I would like to thank Ana Luisa Miramontes, that is the head of the Healthcare Committee under the umbrella of Coincides. She has been very supportive as well. And we are very glad to have Ana Luisa also in this conference, as well as Rosa Maria and Luis Aranguren and Alfonso Urrea. Those are members of the private sector that are really interested to make our projects happen. Then thank you very much to all of you for being with us. Also, thank you very much to Patricia Gascon from the Secretary of Economy in the state of Jalisco as well. Thank you for your interest in this field. And we are pretty sure that with a joint effort that we are doing now, this kind of dreams and visions will be happening pretty soon. It's just a matter of time. Thank you very much. Thank you for your time. This is Coincides. Hasta la próxima. Hasta luego.